Howdy. Catch Me If You Can is based on a true story about the life of Frank Abagnale Jr., and in this movie he is portrayed as bearing some type of disorder. The purpose of this presentation is to show our assessment of the underlying symptoms of Frank Abagnale Jr. and what our diagnosis would be based on those symptoms. Allow me to start with a brief character description. Frank Abagnale Jr. was first introduced in the movie as a teen, so anything earlier was not covered. The time period of this movie was around the early to late 60s. He lived in New Russia, New York when growing up, and it became clear within the earlier part of the movie that the family was upper class. The very first scene showed in an obvious manner that he looked up greatly to his father and mirrored most of his behaviors. One behavior, which is shown in the picture, is a method of bribing. The family lost most of their money due to their debt to the IRS. Shortly after, the mother was shown to be having an affair. These events could have caused a conflict in the marriage which led to the divorce of the parents. The divorce forced Frank Abagnale Jr. to choose between either his father or mother. Not being able to handle the gravity of such a decision, he opted to run away from home. This marked the beginning of what would be a near-ideal demonstration of his diagnosis. So let's get into the evidence. Frank Abagnale Jr. showed many symptoms. He showed a disregard for the right or wrong by breaking the law multiple times. He persistently lied and exploited others, but what he did almost effortlessly was use his charm to manipulate others for personal gain. One instance, which is shown in the first image, was when he was at a bank charming a young bank teller into showing him the process of where checks would go once they are deposited. At that moment in time, he was impersonating a pilot, which is another thing he would do. Impersonate identities or careers he did not have any experience in. Other careers he impersonated were a teacher, an attorney, and a doctor. Lastly, later on throughout the movie, he showed paranoia. In this instance, which is shown in the second image, the main antagonist tells him that there are French police coming to get him, and Frank Abagnale Jr. refuses to believe him. He insists that the antagonist is lying and is just making it all up. But once they go outside of the building, it would turn out that the antagonist was in fact telling the truth. All of these disorders led us to believe that Frank Abagnale Jr. had an antisocial personality disorder. This disorder is a cluster B personality disorder, which means that it is classified as having behaviors that are dramatic, overly emotional, and unpredictable. But this mental illness was not researched during the 60s. This means that he had almost no way of knowing that he had this mental illness because it was harder to diagnose as it was not medically prioritized. Also in the 60s, people did not recognize this illness because they did not believe it to be a significant problem. It was just ignored and thought of being an overreaction of sort. This led to the formation of the stigma that antisocial personality disorder was not treated as a bona fide illness. However, it can get quite extreme. A high-functioning sociopath, which is a term to describe someone with this disorder, can be dangerous as the symptoms can elevate to harmful levels. This led to another stigma to where anyone labeled as a sociopath are assumed to be violent and harmful people. A low-functioning sociopath is almost harmless, as their symptoms would be almost normal. But what kind of treatment would a person, for instance, Frank Abagnale Jr., need to help with this disorder? Treatment can be summed up with three different categories: therapies, specialists, and medications. Therapies that would help would be family therapy, behavior therapy, or psychological therapy. Specialists that could help would include a clinical psychologist and a psychiatrist. When it comes to medication, there really isn't any specifically approved for this type of disorder, but medications for symptoms such as anxiety and depression can be prescribed. Some examples of medications are shown in the pictures. Both of these are SSRIs, which means that they are selective serotonin reuptake inhibitors that block the reabsorption of the neurotransmitter serotonin. This is the hormone that is involved with depression and anxiety. But in summary, there isn't a lot of treatment for people with this disorder at this moment in time. Lastly, imprisonment has little to no effect on people with this disorder as they aren't affected by punishment of this sort. So if imprisoned based purely on the disorder, it would just be ethically wrong because it would just not be helping the person with this disorder. Overall, the portrayal of Frank Abagnale Jr.'s disorder was accurate because most of the symptoms were shown. Some symptoms not shown were aggression, violence, boredom, and substance abuse. One of the most common forms of substance abuse is the use of alcohol. But while exposure of the disorder in film can have a positive effect in eliminating stigmas, it can also be harmful through misrepresentation and inaccuracies, which pose the risk of creation of new stigmas and stereotypes. But overall, we should all collectively work towards accurately describing, portraying, and treating mental illness, such as antisocial personality disorder, both in film and in our everyday lives.